Hi there, Ayla Wolf here with Healing Response Acupuncture and Functional Neurology, located in Stillwater, Minnesota. I am a doctor of acupuncture and oriental medicine and a licensed acupuncturist. And in our clinic, we specialize in treating concussions. And in this video, I wanted to talk a little bit more about post-traumatic headaches and migraines. What happens really commonly is that people with post-traumatic headaches can be misdiagnosed as having migraines when in fact they're not having true migraines. The problem with this is that if people are getting diagnosed as having a migraine, that means they're getting treated as though they're having migraines. And what the research shows is that people with post-traumatic headaches that might look like and mimic migraines or have similar type symptomatology to migraines, they don't respond very well to migraine medication. And that leaves people with continuing to suffer from these headaches and often not knowing what to do next when migraine medication fails. So let's talk a little bit about why this misdiagnosis happens in the first place. There are certain criteria that people have to have in order to get diagnosed as a migraine. And for example, some of that criteria is that the migraine is unilateral, meaning that it's only on one side of the head, that the migraine has a pulsating quality, so a throbbing quality, and then the migraine might be accompanied with nausea and vomiting, or it might be accompanied with light and sound sensitivity, and that the migraine gets worse with physical exertion. So if we look at some of these criteria, we can see right away that in post-concussion syndrome, there's a lot of overlap. People with post-concussion syndrome often have light and sound sensitivity, they often have nausea, they often have throbbing, pulsating headaches, and their headaches can often get worse with physical activity because exercise intolerance is also very common following concussions, especially if people have developed dysautonomia. So while there are some similarities and potential overlap in the symptoms, a lot of times the clinical presentation is different. And what I mean by that is that people with post-traumatic headaches can have unilateral throbbing headaches, but they can also have bilateral throbbing headaches as well that they might call a migraine, but what might actually be more appropriately diagnosed as a post-traumatic headache and not a true migraine. The other similarity too, as I mentioned, is that people with concussions can have light and sound sensitivity, but that might actually be more frequent on a daily basis as opposed to only being associated with clearly defined episodes of throbbing unilateral headaches, for example. So once I've started working with the population of people suffering from brain injuries and post-concussion syndrome, and simultaneously also working with a large population of people with migraines, a lot of these differences started to become very apparent to me, and my treatment started to change dramatically based on whether I was working with somebody that was truly suffering from primary migraines versus somebody that was suffering from post-traumatic headaches. And that's really important distinction to make in terms of getting people the care that they need. If you want to learn more about our services, you can reach us at info@healingresponseneuro.com or visit our website at www.healingresponseneuro.com. We are available for both in-person and telemedicine appointments. Thank you so much for listening.